If you work in healthcare, or if you're a patient or family member, chances are you've heard this question: what about ivermectin and cancer? It's a question that often comes from curiosity, hope, or sometimes frustration. So today, instead of dismissing the question or sensationalizing it, let's slow things down and look carefully at the evidence. This video is based on a 2025 peer-reviewed paper by Robalino and colleagues, titled Ivermectin as an Alternative Anticancer Agent, a Review of Mechanisms and Evidence. Now, this paper doesn't claim that ivermectin treats cancer. Instead, it reviews what researchers have studied so far, and just as importantly, what remains unknown. Before we go any further, let's be crystal clear. Ivermectin is not approved for cancer treatment. This video is for educational purposes only, and patients should never self-medicate or change their treatment plans without speaking to their doctor or oncology team. So, where did this idea come from? Ivermectin has been safely used for decades to treat parasitic infections. Because of that long history, researchers and the public have wondered whether it might have other uses. In science, this process is called drug repurposing. It's when we take an existing medicine and ask, could it behave differently in another disease? That question is what led researchers to explore ivermectin in the context of cancer, mostly in laboratories, not in clinics. The paper by Robalino and colleagues reviewed laboratory and animal studies. In these studies, ivermectin was tested on cancer cells grown in controlled environments and sometimes in animals. Some experiments showed that ivermectin could affect how cancer cells grow or survive. These findings are scientifically interesting, but they are also very, very early. One of the most important messages from this paper is this: what works in a laboratory does not automatically work in people. It's a huge leap. Many substances can affect cancer cells in experiments, including everyday compounds. But they never become safe or effective treatments for actual patients. That gap between early research and real-world care is where careful clinical trials are absolutely essential. For healthcare professionals, this paper helps frame conversations that are becoming more and more common. As of right now, there are no high-quality clinical trials supporting the use of ivermectin for cancer. There is no established safe dosing for oncology. And there are very real risks when medicines are used without medical supervision. The top priority always remains evidence-based care, patient safety, and honest, open discussion. For patients and their families, curiosity about alternatives is completely understandable, especially during such a difficult journey. But using unapproved drugs on your own can be dangerous. It can interfere with proven treatments you're already receiving, cause unexpected and harmful side effects, and create false hope or unnecessary harm. The safest and strongest step you can take is always having an open conversation with your healthcare team. They are your best resource. Now, even though ivermectin is not a cancer treatment, this review paper still matters. Why? Because it helps researchers decide which ideas are worth exploring further, which ones need much stronger evidence before moving forward, and which ones should be set aside. This is how medical knowledge grows carefully, slowly, and responsibly. Dosumitep. The paper by Robalino and colleagues does not recommend ivermectin for cancer treatment. It simply highlights scientific questions, not clinical answers. Any and all decisions about cancer care must always involve qualified healthcare professionals. The topic of ivermectin and cancer gets a lot of attention because it sits right at the intersection of hope, science, and uncertainty. But for now, the evidence is early and incomplete. Education, careful research, and above all, patient safety must always come first. Thanks for watching. If you found this information helpful, please like this video and subscribe for more evidence-based content.